so the care home we were working in, we had to build the app so that it would work offline, so that they could write notes and it would save it and upload it later. That was absolutely essential because they did have some Wi-Fi, but like as they walked around the wards, it would drop in and out. Like it was quite dodgy, and the devices wouldn't always connect to another ward's Wi-Fi and things like that. So it did get quite complicated. But the other thing that we learned that was quite interesting was when the carers were walking around with devices, that the family was suddenly like, "Why are you texting whilst you're looking after my relative?" The iPods that they were using all had cases on them with a sticker so that they looked medical.
Oh.
And that changed the way that people responded to them.
I love how a sticker makes it look medical.
It's a little sticker with a sort of symbol on it.
Yeah.
I can't remember what it's called now, but it's very important. It's very important that it looks official.
And from so the informal care context with this is kind of interesting because there was a slightly self-selecting group who we ended up doing research with because they put themselves forward for this, but also they had to be people who had either an iPhone or an iPad. So there was already a certain level of technology, confidence and competence and use and experience that we were working with. And there's so one of the first things actually that came up was at the very beginning of the project when we were commissioned by the Department of Health to answer the question of what can citizen science be for the context of dementia. We reached out to the dementia research community and we spoke to a lot of experts and researchers across academic institutions in the UK, and a lot of people actually said that this project wouldn't be viable because people with dementia can't use technology. And that was something that actually quite a few people said to us who were experts in dementia research but just hadn't done dementia research with this context. And in one of my very first interviews and one of the first sort of pieces of research that we did, where we brought in an iPad that had an early kind of envisioned prototype of the app, and I showed it to this 80-year-old woman who had dementia, and immediately she was like, "Oh, how does it work?" And she started swiping, and her carer sort of helped her out, and immediately she was swiping, and she pressed a song and was like, "Ah, yes, this is, what was it? I can't remember, it was Frank Sinatra," and she was like, "Frank Sinatra," and she immediately started singing. And so she was interacting with this thing in ways that we all interact with it. So there was this immediate kind of, maybe not immediate, but there was a bit of time where she was then able to use this app. And we found that when we introduced prototypes to people to use over a slightly longer period of time in the previous phase of research, some of the couples, the people with dementia and carers who had used it, said that over time the person with dementia did sort of learn how to use the app and the iPad, and that over a longer period of time they felt that they could possibly use it even more independently. So learning still was possible within this context, and they were able to use it consistently. So that again kind of confounded some of those initial assumptions that we heard from even the kind of community of experts, which was kind of interesting. And then finally, sort of related to what I talked about before, about the couple of people who we'd spoken to who had earlier stages of dementia. So these were people who were in their 50s or 60s and who were very used to emailing and texting and using apps and using their phone. And in one of my interviews, I was like, "So, how do you feel about this?" And he was like, "Well, do you know what? What this should be is it should be a killer app. It's not yet a killer app."